Good evening. My name is Josh Quick. I'm the superintendent of schools here in Robinson Community Unit 2. Thank you for joining us. We have a nice panel of community partners here with us tonight to give an overview of not only the school's procedures but the community's procedures for COVID-19, and to have an opportunity to answer some questions. We had several questions that were submitted in advance. We will also try to monitor our Facebook page for questions that come in as we speak, and then we do have some folks here live in the audience as well. So the first thing I'd like to do is welcome our panelists here, and I'm gonna get up and walk around and have each introduce themselves, and I'll tell where they're from. We have representatives from Crawford Memorial Hospital. So ladies first.
Hi, I'm Tammy Fralicker, Chief Nursing Officer.
Doug Florkowski, Chief Executive Officer.
All right, and we have several representatives from Lawrence County Health Department.
Megan Jurgens, mental health therapist. Allison Fiskus, nurse practitioner.
Amy Marley, communicable disease nurse and administrator.
Chad Kroll, director of IT.
Okay, your video.
Oh. Blair, environmental.
Thank you. And from Crawford County Health Department?
Jenna Thompson, nursing supervisor.
Darla Tracy, administrator.
And then we have some folks from Robinson Community Unit 2 as well.
Cindy Rimmel, school nurse for Washington Elementary and Middle School.
Right on, Paul now.
Jim Weber, school nurse at Robinson for Robinson High School and Lincoln Grade School.
Amber Ramsey, school counselor at Lincoln Grade School.
Thank you. And one of the things that's been so reassuring for me as we planned for our return to school is that we do have community partners to assist us and advise us as we develop our plans to bring our kids back to the buildings. So the first thing we're going to do is just kind of each group that's represented is going to kind of give a little overview of what their role is. So for the school district, we had a planning committee of about 33 individuals that met throughout the month of July. And what we did was take the state guidance that came from the Illinois Department of Public Health and the Illinois State Board of Education, and we tried to create a plan that fit Robinson Unit 2 while responding to those guidelines that were provided to us. So some of the key points from that ISB and IDPH document are that appropriate PPE, including face coverings, are required while inside a school building. No more than 50 individuals will be gathered in any one area. Social distancing will be maximized whenever possible. Students and staff will have daily screening or self-certification of symptoms, and cleaning and disinfecting protocols will be strengthened. So that was the basis for our plan, and of course our plan from the beginning was that we wanted to try to bring kids back to school in person, and we felt like that we could respond to that guidance and be able to do so. Okay, so I'm going to let each of the other organizations kind of tell what their role has been and just give a little overview of what they do. Can you start, Jenna?
Yeah. First of all, I want to say Mr. Quick and his staff have put in a lot of hard work trying to get ready for the school year. And we're trying to help make this a successful year, to help keep the kids in school, keep them healthy. What we do is we will help with situations with decision making regarding quarantine, isolation. We've been doing contact tracing now for quite some time. We'll have staff available evenings, weekends for the school if they have questions regarding if a child should be quarantined, isolated. So we're here to do whatever we can to help the schools in our county make it a successful, healthy year.
I guess I'll speak for both Kim and myself. We were part of the back to school committee and making the plan that our students and staff members will be following. Our role in this obviously is to keep our kids safe and healthy. We'll be assessing those kids at school that come to us that are symptomatic and determine whether or not they are safe to stay at school or if they need to be sent home, and we'll be working closely with the health department on that. Is there anything you want to add?
So again, I'm Amber Ramsey, the school counselor at Lincoln, and I was also on the back to school committee. And I'm, the IDPH back to school plan and our unit back to school plan had an emphasis on social emotional considerations. And so on behalf of all of our school counselors, our role in this would be to continue monitoring the needs of our students. A pandemic is a traumatic event, so just considering their anxiety as we proceed. So.
I'm Amy Marley. Like I said, I'm the administrator at Lawrence County Health Department. We work very closely with Crawford County Health Department and have been in your area for approximately a year now providing behavioral health services. We have been working with the school districts in Lawrence County and brought some of the services that we have available to assist Robinson School District and those in Crawford County to return to school safely and provide some guidance and some assistance to Crawford County as well. Regarding providing services like nurse practitioner within the schools to help mitigate and prevent the spread of COVID so that we ensure that your children are allowed to remain in school. So that's part of what we're doing.
My name is Allison Fiskus. I was hired by the health department to be the clinical care coordinator for COVID as a nurse practitioner. I have assisted Lawrenceville and Red Hill school districts in their reopening and trying to keep everybody up to date on the new IDPH guidelines because they change all the time. So I am there to help assess and get everybody back in school as safe as possible. And keep them there.
My name is Megan Jurgens. I'm a mental health therapist with the Lawrence County Health Department, and my job is to help parents and kiddos as they go through this pandemic with some of their mental health needs. And if the school is needing some extra assistance, we can provide that as well.
Hi, I'm Doug Florkowski, CEO at Crawford Memorial Hospital. We'll be providing the healthcare support for the students and their parents and families. We've geared up. We have our rural health clinics have designated hours in the afternoon that will be set aside for specific COVID testing if your child has symptoms. We can also schedule, you can also use the walk-in clinic that's available without an appointment. They've been geared up as our COVID site since March 12th when the declaration was made, so we're ready to handle those patients and those students as well in that setting.
Okay, so just speaking in general about the school's plan, as I said, there were 5 key points from the Illinois Department of Public Health and the Illinois State Board of Education that were essential and kind of guided the rest of our planning. We chose to split our big committee into 7 different subcommittees, each that had kind of a specialized area that they looked at. So those were transportation, food service, symptom screening and quarantine procedures, physical environment and procedures, instructional design, technology and internet access, and then cleaning and disinfecting procedures. So each of those groups met throughout the week, each week, and then we had a weekly meeting of the big group together just so that we were keeping in touch and could communicate about what each of the subcommittees were doing, to make sure that we ended up with a consistent plan and things that worked well together within the different areas. So think we'll start to dig into some questions here. And we've got two different sources of questions that were submitted ahead of time. And so I'll just kind of go down and we'll let whichever of the panelists feels like they're most qualified to answer is certainly willing to, or welcome to jump in. And then Mr. Glosser will be monitoring for questions coming in on Facebook. And then we do have a few people out in the audience too, so we'll kind of rotate between reading questions from our sources, live audience members, and then the things that are coming in on the Facebook page. So I'll start with one of the questions that was submitted ahead of time. It says, even with self-certification, will temps be taken when entering the school? So all of our staff members are taking their temperatures as they enter the school. As has been put out to parents, we're asking parents to pre-certify, to do a wellness check on your child, your students each morning before you send them to school, and to document that for us. We will, as a backup, we do have the capacity to screen student temperatures at the door as well, and the bus drivers will have the capacity to screen temperatures before a student gets on the bus. So if they show up and they do not have their wellness check documentation from their parent, we do have the ability to do that before they get on the bus or before they walk in the school door. We have also purchased some thermal scanners that we will have at the main entrances to the schools, and that's just, again, another little backup. If there's a person that walks through that does have an elevated temperature, it will give us a little warning. We can take that person aside and do an individual screening with them as well. Okay, and we had a lot of questions that were related to quarantine procedures. So I'm going to read one of those because that I get to pass the buck around here to the health folks. So if a student is exposed to COVID at school, does everyone in the house need to quarantine for 14 days or just the student?
No, the student would quarantine if the student became symptomatic, then the family, or positive, then the family too would quarantine.
No, every situation with quarantining and isolation is going to be individually based. So I think it's going to be, as Jenna was saying, it's going to be based on what their level of exposure is, so that we can determine how we have to handle the situation as far as quarantining and isolating. But one person being exposed in a household to just as a direct contact was not quarantining their entire household.
Okay, question from another source that was pre-submitted. What is the threshold of positive cases to go to remote learning? As of this week, the school districts have not received any specific guidance from our state agency in terms of a specific metric that we need to look at. However, I know that the IDPH has, I think in the call that I was invited to listen in on Monday, that they are working on some metrics that they're going to share with the local health departments that would help us in making that decision as to when we needed to change to a different learning model. Is that accurate for my health department friends?
Yes.
Anyone want to elaborate on what that looks like? Or?
Do you want to go into it, Jonathan?
I'll let you have that one, because I'm not up on all of that right now.
Every county is going to be different, every school district is going to be different, and every school within your districts will be different when we look at different metrics. The goal of the public health department, as well as the providers within your community, is to keep our schools with in-person learning for as long as it is safely possible to do so, ensuring the safety of the staff in the school. We are going to take all things into consideration and make different types of adaptations within schools to keep them open. So for instance, we are working on a survey that will be distributed to all schools that we are asking the school nurses to send to the health departments and to the nurse practitioner that will be working with the schools, so that we can look at the metrics and see if we can identify clusters in areas, or say we see something, and I'm not as familiar with Crawford setup in their schools as I am with Lawrence County. But we have pre-K and kindergarten hallways, and then we have typically first, second grade, those types of things. If we see in a kindergarten and pre-K hallway that we have 2 or 3 students missing on one day, and then the next day they report information to us, and we see that we've had a child or a teacher test positive and we have additional students that may be excluded at that time, but yet the remainder of the building and other school buildings within the district are fine, we're going to address that on a hallway level so that we can try to keep these schools open. It is truly going to be based upon right now, is from my understanding, is the districts. Your certain schools, your districts within your counties will determine what their metrics are. So please know that our main goal is to keep your schools open and operational. Do you have anything else to add to that? So.
Okay. We do have a few people in the audience. Would you like to ask one of your questions next?
Classrooms, how many students to a class per teacher? With the 6 feet apart social distancing rule, how many classrooms and how many kids are going to be in that classroom?
Okay, so the question was how many students in a classroom with the 6 feet of social distancing? And that will vary. Our numbers will be down slightly because we do have about 10% of our students that are going to be remote learning. And our guidance from the state says that the students have to wear PPE 100% of the time unless they're eating or drinking in the school building. Regarding the social distancing, it says social distancing will be maximized whenever possible. So it's not a 100% mandate that they have to be 6 feet apart all of the time. And in fact, that will not be possible. So what we have done within the classrooms is removed any extra furniture and tried to set up the classrooms in such a way that the students are, the space between the desks and the students is going to be maximized. So I'm not aware of any classrooms at the elementary level are typically going to be around 20 this year. At the high school, they may run 20 to 25 in a classroom. But within those rooms, we're going to keep the kids as far away as we possibly can.
There's a question here. It's been somewhat answered, but the question is, will Washington dismissal times be staggered to provide large groups of parents in the gym to pick up their child? There's been a couple answers on here, but maybe a clarification would be needed.
Okay, luckily we have a man here that can answer that question. So the Washington school dismissal times, Mr. Stark, can you give us an overview on that?
We will be dismissing, at 2:35 for our buses. So bus dismissal time will be at 2:35, and then we will actually have parent dismissal, parent pickup after the buses have left the facility. So that will just allow us to practice as much social distancing as possible while we're going through the dismissal process. And it also is going to be a drive-through pickup instead of what we have traditionally done at Washington Elementary was where the parents came in and would pick their students up in the gymnasium. So that information is going to come out in an email to all our Washington's parents, and that will probably come out tomorrow or Saturday early sometime. So it just depends on how the next couple of days go for us. Thank you.
Okay, we'll go to another, this is kind of related to the other quarantine question. If a student tests positive for COVID-19 in my child's class, does our whole family have to quarantine? So if a student in the class tests positive, so I know that's going to be another, it depends.
Well, if you have a positive in a household, most likely they're close contacts to the rest of the family. If there's a way that, like one parent can go stay somewhere else, or somewhere that are a close contact, and most likely with the child living in the house with the parents, they're gonna be a close contact. Therefore, they would have to quarantine. But that's just with a positive. That's not, was the question if
It
the
was
third
if
child
it
was
was-
positive, or if
No,
there's
it
a
was
child in the
another
classroom?
child in the class
Oh,
was
okay.
positive.
Okay. No, they won't, I'm sorry, I got the wrong child was positive. No, the family would not, unless the child that was quarantined due to the positive in the class started having symptoms or would test positive.
I can go into that. And this is where one of the areas that your nurse practitioner is going to be working with your schools, your teachers within your school district. Seating charts are going to be an essential tool to monitor and do the contact tracing within these schools. So Allison will be working with the school nurses, working with the teachers. It's going to be necessary for us to realize where everyone is seated in your classrooms, on your buses. That is going to identify for Jenna when she comes in on a contact tracing case to know exactly who we need to get to immediately. So if you have one child that has sat within 6 feet distance for the majority of the day, that child is obviously going to go home as a direct contact. If you have a child that's sitting on the other side of the classroom and contact is minimal, the likelihood that they would be going home as direct contact would be slim. So once again, very individualized, no one's trying to sidestep the answers, but it is truly something where you're going to be working very closely with your nurses at your health department.
Mr. Quick, if the numbers continue to rise, can we choose remote learning at any time?
Okay, so the question is, if numbers continue to rise, can we choose remote learning at any time? And I would say that in response to that, we want to be flexible with you on that. It did require some planning for us to get all the materials ready for those who chose remote learning at the beginning of the school year. But we can certainly make adjustments to that if a need arises. So I would encourage you to reach out to your building principal or to myself to work out those arrangements if that becomes necessary.
This one kind of goes back, I think, to what you were saying. It says, based on that information, if one child tests positive, the entire class will have to quarantine for 14 days?
And that's not necessarily.
No. Again, we're gonna have to assess each situation, but it's going to be if they are considered a close contact, which is 6 feet or less for 15 minutes or more. But we're not gonna just look at the classroom. School staff has seating charts for not just the classroom, but the lunchroom, seating assignments on the school bus. So we're gonna track where that child was all day. We'll look at throughout the day, and anyone who is a close contact, they will be quarantined, but not the entire classroom. Again, though, like I said, there's gonna be different situations. If we have a child that is just really displaying symptoms, coughing, sneezing, we may go a little farther and quarantine a little bit farther out than just that 6 feet, because that's possibly spreading a little bit further. But like I said, we're gonna assess with each situation, but, no, it's not, the whole class will quarantine. If we start getting more cases in one class, that one class may quarantine, it doesn't mean the whole school does. Like Amy talked about earlier, you might have a certain hallway, the kids are on that side of the school, and some kids in the classroom, but not necessarily the whole classroom unless it's deemed necessary due to more cases in that classroom.
Okay, and we had another written question that's kind of related. I think it's been somewhat addressed already, but if one school is shut down, will all the schools be shut down? And that's going to kind of related to your response that you just gave. It's going to depend on the situation, but not necessarily. Ma'am, would you like to ask another of your questions?
Okay, so I went for my tour today of your Lincoln grade school. Your principal told my husband before that each student's class had their own desk and they would have pods around those. Then today I went for my visit at the school. There was no social distancing with any of the students, with any of the parents. They had 50 plus people gathered in a huddled group going down a hallway with at least 30 people in each group. What is your response to that?
Well, our maximum group size is 50. As far as the individual pods around desks, we do not have those in place for the classrooms that have desks. As I mentioned earlier, we're going to situate those rooms so that the desks are as far away from each other as possible. Our guidance again is that we maximize social distancing. It does not mandate that we have them 6 feet apart 100% of the time. There are some areas of the buildings where face-to-face contact is necessary. And in those situations, we do have the plexiglass dividers that we purchased to accommodate, for example, like with our speech pathologists, with our counselors in the offices, in the cafeterias, where there's going to be face-to-face, where they're actually facing each other. We purchased the plexiglass dividers for those situations.
Okay, because today none of that was displayed at the school. The principal showed us markings on the tables where she had each student sitting, and they were less than 3 feet apart. So basically, me, an empty spot, a student.
And that was in the cafeteria.
That's in your cafeteria,
Yeah.
and that was showed to me by your principal, Ms. Beaumont, today, just at 4:30.
And as I mentioned earlier, there are going to be some situations where they're not going to be the 6 feet apart. Is there anyone else that has a?
Is your concern because they're going to be in the cafeteria eating and they're going to be without mask
Yes.
at 3 foot apart?
Right.
Okay. So,
Mr. Quick, the students will all be facing one direction. They will not have students face to face.
That's not how they had it set up, because I just came from there, and that's not how the principal there is displaying it either. What she told the parents there was how she had it set up and how they would be sitting. So you can see my concerns as a person in remission. My concerns are greater. I don't feel safe for my child going to school there. I also asked her if it would be okay to go ahead and change my mind and go to remote learning, and she told me that was not allowed either, that it was too late.
did you have a private conversation with her about that?
Yes, a conversation with her and her assistant helper there at the school and my daughter.
I would think that with this many concerns, just as another parent that has a student going to that same school, I would address her privately and see if maybe you could directly speak with her tomorrow about your concerns, because I think maybe there was a miscommunication or something there. Mrs. Beaumont only has the best interest of our kids in mind. And I can assure you, she would not put our kids at risk. And especially if you have a personal health concern, she wouldn't want you to have extreme worries in that regard either. I would address her tomorrow, maybe call the school and see if there was a way that you could set up a time to meet with her privately and address that.
I did speak with her privately today.
I would do it
Those
again
were her
tomorrow.
responses.
Yeah, but it was during the
No,
tour
after
today?
the tour was over.
Yeah,
She stayed to speak with me privately.
Yeah.
And those were her responses,
yeah,
which is why I came here, because I have a lot of concerns.
sure.
And I would just like to stress, this is a new platform for all parties involved. This is not anything any of us have ever done. I can tell you from opening 2 districts in Lawrence County, there are going to be hiccups along the way. There are going to be situations we identify in the first day of operation that may be different the very next day. So this is truly, although some of the concerns that you have, that they sound like that we need to discuss and you need to discuss with the school district immediately. I think that parents, and that's what I'd like to stress and what we've stressed in the districts that we've opened already, patience is going to be a quality that everyone is going to need to demonstrate right now, because this is a huge undertaking. the guidance that your schools, not only your schools, but your local health departments, your hospitals, we are receiving changes daily. The algorithm that we have today is different than the algorithm we were given 2 days ago. So it is a constant battle for us to keep up with what the current recommendations are and how we are best suited. These schools are making adaptations that these schools are not set up for. The primary way these children have always learned is by gathering and doing so in groups. We're now going against everything that they've ever done in an educational basis. So it is a little bit different, and I do understand your concerns. Please, I'm not trying to, I don't want you to think I don't validate your concerns. But I do think it's a conversation that needs to be had again, and maybe, you're talking to people that are not healthcare oriented. So it may be something that you bring your health department in where they can work with the school district so the concerns can be addressed on that level.
And we can facilitate that discussion. Okay, we'll go to another written question, and this one I'm definitely gonna have to lean on healthcare folks as well. In regards to face coverings, have you considered prohibiting ones that include exhalation valves that do not protect others? So I'm not actually aware of what that is.
To be honest, I hadn't heard of it either, but I'm sure the answer is going to be they won't be permitted. I mean, that's the whole reason of masking, so that you don't emit droplets into the air. So I can pretty safely say you're not gonna allow those.
Okay. How will I know what one is when I see it?
I was gonna say, are they referring to like what the mask that, like?
There are some like this that have valves that allow you to breathe out, but they also have some, this one has valves, but it also has HEPA filters.
Sure, right.
So if you have one with HEPA filters, you're getting the same filtration that you're getting from one of these other masks.
Right.
If you have one that does not have HEPA filters, then yes, you are pushing droplets out and it is not benefiting the people around you. So it's one of those things that they need to, if they have something like this on them, they need to inspect them for filters. Yeah.
To see if it has the filters.
Yeah.
If it's filtered.
If it's
okay.
filtered, you're getting the same protection. If it's not filtered, you're not. The person wearing the mask is getting the benefit of it, but the people around that person are not.
Good. So, I've learned the first of many things, but I'm sure I learned for that. Okay, another written question that was submitted, was a nurse practitioner hired to help the schools, and if so, what is their role? So I know who I can pass that to. We'll pass it to the nurse practitioner.
I'm actually employed by the Lawrence County Health Department to help combat this COVID, I guess, in a way, just to make sure everybody's up to date on the new guidelines and help assess these students so we can keep them healthy and in school as long as they can. I have kids in the school system, and they've learned so much better from their teachers. You know, I can't imagine having to go a whole year with remote learning, so I'm going to do my darndest to keep these kids healthy and in school as safe as possible. But I'm hired by the Lawrence County Health Department.
And we're very thankful that she'll be able to work with us as well. Andy, got anything on?
I've got one.
Okay.
Nettle gets out at 1:45. Will bus riders be brought home, or will they have to wait for the other schools to dismiss?
And that is, I'll have to give an incomplete answer to that because some of the students will be brought home immediately and others will remain on the bus until the other schools dismiss. And those arrangements, the transportation department will communicate individually as far as what the estimated time home is, but yes, some of them will remain on the bus, but some of them will be taken home immediately.
Another one, I'm not sure you'll be able to answer this one, but it says, when do you anticipate the classrooms going back to normal?
Okay, the question is, when do we anticipate classrooms going back to normal? I would love to be able to answer that, and certainly I think we're all looking forward to that day when they can. the technical answer is when Illinois enters phase 5, when we've achieved all the metrics for the state to go into phase 5, which my understanding is that the criteria for that are either widespread testing and effective treatment or a vaccine. Okay, there's another question here that was submitted, and a portion of it is having to do with the buses. And our guidance on buses is that we can have 50 people total on a bus. And obviously, again, they're not going to be 6 feet apart on a bus if we can have 50 people on there. It asks about having 3 kids to a seat. We will not have 3 kids to a seat this year. We will have seating charts so that we, again, as the health people have mentioned a couple of times already, we want to know exactly who has been in close contact with every student, so we do want those seating charts on the bus as well. And then another part of that question was, how do you plan to combat COVID when you're only checking them when they arrive at school and not before the bus? So again, we're asking for parents to help us with that responsibility of doing the wellness checks before they put them on the bus. But if they do arrive at the bus and they do not have their documentation from their parent, that bus driver will have the supplies necessary to screen the temperature and ask the student the questions as they board the bus. But certainly we would prefer that the parent take care of that at home before the child gets on the bus. Okay. Would you like to ask another question?
Well, what about your PE classes? What are those kind of procedures going to be as far as the children doing exercises, running, jumping, the baseline performance?
Okay, what did you say? PE? Okay.
Can you repeat the question?
Sure. The question was, what about PE classes and how will those be addressed as far as the kids exercising and things like that? So we have a couple of principals here. Would you guys like to take that one on?
Sure.
Just speaking for the middle school level here, students are not going to dress to start the year. However, we are going to ask that they bring tennis shoes or wear tennis shoes to school. They will be doing activities like walking and possibly playing some games that would not involve equipment being passed around to multiple students. And they'll also do some yoga activities, things like that, if they have to be in the gym due to inclement weather. For the most part, we're going to try and take them outside as much as we can, and have them be as active as we can, while realizing that they aren't dressing for PE. So
Are they still going to be required to wear masks while they're outside?
that will depend on the activity. If it's an activity where they have to maybe be somewhat close to each other, where we cannot maintain the 6-foot distancing, yes, we would require them to wear masks. Hopefully we can figure out a way to spread them out enough that they do get some time without masks during PE and other break times during the day.
Yeah, I'm going to echo the same thing that Mr. Beal said for Washington Health, which I can't speak necessarily for Lincoln, but I do feel like they have a very similar procedure in place. We're going to work to get the kids outside as often as we possibly can during those times. So recess and PE will be opportunities where we can go out and have the kids outside and be a little more socially distanced, a little more easy. We have a little easier time than maybe some of the other buildings will, because we have a huge park next to us and we have a large space behind the school that we can use to spread out. But we will be getting those kids out there as much as we possibly can. And we will try to give them breaks from the mask when the opportunity presents itself. But we're going to do the same thing. We're going to try to use different techniques, fewer shared equipment things, that if at all possible.
Okay, I'm going to read one of the questions here that was submitted on our online form, and I think it may give us an opportunity maybe between Jenna and our school nurses here to provide a little bit of an update as has been talked about throughout the evening already. We're dealing with new guidelines that are coming out constantly, and in fact, we got a nice form from IEPH earlier this week, and then already this afternoon it was updated again regarding the the exclusion criteria. So the question is, on our pre-screening form, it says that I certify that my child has no symptoms of COVID. However, in part of the plan that was sent home, or part of the plan that we put out, it says if they will be sent home if they have 2 or more symptoms. So if my child has only a runny nose and no other symptoms, technically I can't say that they are symptom-free. However, I can still send them to school since they have 1 symptom, and that's a question, which that's her question. Can I still send them to school because they just have 1 symptom? So that has changed already since we put the initial version of the plan out. And so I don't know if Jenna or Cindy wants to.
And correct me if I'm wrong, because I did not have time to read through that because it just came out today and we was very busy today. I'll have to read it tonight, but I do know now it is just 1 symptom. It doesn't have to be 2, it's just 1 symptom. And if your child has that 1 symptom, they either have to have a COVID test, a negative COVID test to return to school, go see a physician, and get a excuse or a note for what the physician diagnoses them with that is not COVID, or stay out of school for 10 days. We would highly recommend that the first move would be to get a COVID test and have the 100% or the assurance, it's not 100%, but that they are negative for COVID. Anything you guys want to add?
I was gonna ask, do you, as the health department, do you recommend waiting a certain amount of days for the test, or do you recommend immediately testing?
If someone's exposed to a positive case, we want to wait 5 to 7 days because it has an incubation period. So testing the day after they've been exposed, you're going to get a negative. If they have symptoms, however, you got a child in school with symptoms, that virus is already in there. So we want to test them if they have the symptoms.
I totally agree.
All right, and I will say that Cindy and Kim, our school nurses, are working on a 1-page overview, kind of a graphic representation of what happens in each instance when any of those symptoms are exhibited, or when they at school notice that one of the students is exhibiting any one of those symptoms. And it's kind of again, just a chart that shows it a little bit more in a simple, easy to understand way, I believe. Okay. This question is, why do other businesses such as Walmart with multiple cases not have to shut down, but 2 cases in a 14-day period for the schools is considered an outbreak? And I'm not familiar with that criteria, so.
I could try here. I don't think you don't shut down with 2 cases, do you? They have to be.
I think they consider an outbreak
It has
in
to
2
be,
cases.
they have to be related. If we have a case in this school, and one, they have to be related.
We have to be able to link them.
Yes.
epidemiologically.
So it's not automatic that 2 cases is gonna shut down a school.
Right.
And if you have one here and one at Washington, you know, if they're not related, then that's not gonna be a cause for closing. What was the other part of that?
And why are they allowed to stay open?
Oh, Walmart, I'm sorry, but I have no knowledge of multiple cases. I don't know what more to say on that.
Yeah. It's considered a critical infrastructure, it's an essential business, so that is why, that it doesn't. The outbreak status is the term itself is somewhat, I guess, makes you feel somewhat apprehensive when you hear us talking outbreak. Outbreak has several advantages to it, especially as far as IDPH and the testing requirements. When we move into a preliminary outbreak or something of that nature, and we test a large number of people, when we link them to an outbreak, those tests are typically turned around very quickly because we're trying to identify and mitigate within an area. The cluster of 2 is really nothing unusual for us in a communicable disease world. I mean, anytime we can identify a cluster or something that we can link, meaning that it's not a household contact, but the transmission occurred within a location. I mean, we can link a relationship to that. That is considered how we're considering an outbreak at this point. So that is what we're doing, and I don't know of anybody that has had in Walmart. I don't think we've identified multiple cases.
I don't know what multiple is, but
Right.
we do not have multiple cases.
The majority of where you're seeing those types of outbreaks that you're hearing about is in a congregate setting, in a setting where you're seeing multiple people for long extended periods of time.
Okay, and I'm gonna kind of group together a couple of questions here that are related and they're related to what we just answered, but if a student starts showing signs of COVID while at school, such as a headache or runny nose, will my child be sent home, even if these symptoms are common for this time of year? And then a related question, if my child has a cough or headache, will they be out of school until they see a doctor? Or can they be out of school just for the day and come the next day?
They will be sent home, even if it's like a lot of people have issues with sinuses. Initially, for sure, they're gonna be sent home. Again, we're gonna go back to either a negative COVID test 10 days out or a note from a physician. And no, they can't, so no, they cannot return the next day. Initially, it's going to be a little bit more difficult, but your school nurses know your kids. There'll be some evaluation a little bit later on. It's not like today there's a runny nose, they had a COVID test, it's negative, it's a child with allergies that's on medicine. We're not going to turn around, he comes back after the negative COVID test, his nose is still running, we're not going to send him back home again and just keep going through that routine. However, you can't send a note to school on the first day saying, my child has allergies, and that cover the whole year. So it's again going to be something that Allison will assess, the school nurses will assess, and they will consult us if need be.
Ash, you wanna add anything there? I hate to leave you guys out there on the end.
No, I mean, we concur. I mean, we're gonna test them. If you send them, the parent brings them in, we're gonna test them.
I mean, we're gonna take care of the students that present to our clinics, so if they have the symptoms and the parent brings them in, we're gonna test them. So, I mean, it's obviously the provider's discretion, but the symptoms are the symptoms, and we'll go off of what the school's list is and treat them appropriately.
Mr. Quick?
Yes. Sure.
First one is just, will lunch boxes be allowed? Lunch boxes be allowed?
Will lunch boxes be allowed?
Our high school has said that there will be 3 designated areas to place those in the morning, but I don't know about the other schools.
Okay. Lunch is allowed at Washington? I
Washington Elementary will allow lunch boxes. The kids can bring in the lunch box that they purchased at Walmart or wherever, so.
Mhm. And they'll have a designated area to keep their own things there as well?
Yes, they'll have a spot, just like we've always provided the kids for them. They'll actually have at Washington Elementary, they'll actually have a bucket that they'll stick their lunchbox in whenever they come to school. So
Okay.
it'll be kept separate, just for them.
Washington has buckets for each student to keep their personal belongings in, so that's a great idea. And at Nuttall, I assume Andy, that it's okay to bring a lunch.
Yes.
And Mrs. Piedmont is with us, at Lincoln, it's okay to bring a lunch, Mrs. Piedmont?
Yes, it's fine to bring a lunch, and they have a designated place to put their lunch, so it won't be touching anybody else's lunch.
Okay, so it sounds like all 4 buildings, it is definitely okay to bring a lunch box, and they'll have designated areas to keep those within the building. Got another one?
Here, yeah. I think we talked about the students, but they're asking if a teacher catches COVID, what will happen concerning that teacher's class? Will a substitute be brought in, or will that class be quarantined? How would that work?
Okay, so that will depend largely on, and as our health experts have said this evening, who gets quarantined is going to depend on the individual situation. So if there are people within that classroom or students within that classroom who meet the criteria of close contact or the situation otherwise warrants that, it is possible that students or multiple students may be quarantined within that class as well. And if it gets to the point where, we've got the majority of the class quarantined, some of that is going to depend on the ability of the teacher. If the teacher can provide remote learning, that might be a possibility. If we need to employ a substitute to come in and work with the in-person students that remain in the class, we will do that. So the answer is going to kind of depend on the situation and who ends up getting quarantined within that classroom. But we're prepared to deal with a number of different outcomes there in terms of, if the teacher gets sick, what are some possibilities for the students in that class. But if no other people in the class are quarantined, or if it's just a couple of students that are quarantined, we probably would look at a substitute teacher to continue to provide the in-person learning.
So I think this was addressed, but if a child is sick, will a COVID test be required before they can return? And there was also a question, can the school test without my permission?
I mean, the answer to that is no. Yeah, we won't test without permission. We don't have the capacity to test for her right now on campus anyway. Whether Allison wants to address that, or we don't have the capacity to do that, and we definitely, if we did, we would.
If the child is sick, we will contact the parent, and the parent will have to take them to their provider, or the acute walk-in clinic, or wherever who their physician is, to be cleared to come back to school or get the COVID tested.
So at this point, we don't have the capacity to do that on campus, but if we did, then certainly we would not do that without permission. And was there a second part to that?
No, I think that's right. Yeah, I think we're good.
Okay. We've got a couple of questions here that I'm going to kind of group together again that are related to parent concern about, sounds like the legal liability coming back on themselves if they say, in the morning they're doing their wellness check and they're saying that the child was fine when they did the wellness check before they put them on the bus or before they dropped them off at school, but then they start running a fever and have symptoms and test positive. Is that going to come back on us as parents? Is one way that was worded, and the other way it was worded is, could we be legally held responsible? So I'm definitely not an attorney, so I won't answer this as if I am. All I can do is say that if you are doing your due diligence as a parent, as we are as the school, to make sure that the student is okay before they come in the building, then that's the best that's what we expect of you, and that's what we expect of ourselves, that we're checking to verify that the student is well when they're coming to school. So if something, it turns out later on that they were an asymptomatic person or something to that effect, I don't know the legal legal answer to that, but it wouldn't certainly be something that we would look at as a school as something that was negligent or anything like that. Anybody else have a thought on that? I don't see any attorneys in the room. Okay, so here's a question. What are you planning to do if children start to test positive for COVID-19? Heaven forbid that happens. I would agree with the writer, heaven forbid that happens. So what are we planning to do if children start to test positive for the COVID-19? I guess it's already been somewhat addressed, but.
As I say, it would depend on how many cases, if they're related, and which school. It's hard to answer that just with a one sentence answer, because it's just going to depend on the situation. And then as regarding as to if a classroom or a building would be shut down. So that's all I can say on it. Do you have any more guidelines you guys have been given?
We don't have any specific metrics at this point in time, so it's going to be on a case-by-case basis and working with
For
the
us, is that
department.
if we've got the two connected cases, if they're not, if we can't track them to that they are connected, then two cases doesn't shut you down.
Okay, and then there's a question about how do we expect to fit 30 to 50 students in a classroom when the classrooms are small, and get the students' assignments done when they have an unlimited time to do them and to get them. So the first part of that question, I don't know of any situations at the elementary level where we would have more than 20 or so students in a room at the same time, other than in the lunchroom. And as we talked about earlier, we have made arrangements in the lunchroom to spread them out as far as we possibly can, and also to keep them in cohort groups. And that's the same way at the other buildings as well. And then I'm not sure the second part of the question, get all their assignments done and turned in when they have an unlimited amount of time to do them and get them. So I'm not sure I completely understand that part of the question, but I guess I would just mention there again that we are all going to be flexible. This is new for everyone. We know that kids are going to have additional challenges, our staff members are going to have additional challenges, our parents and families are going to have additional challenges. So patience and understanding are going to be keys to making the start for the school year successful.
Mr. Quick, there's a lot of conversation, a lot of concern about kids with allergies. I'm sure maybe the nurses like students with allergies that are going to show some of those symptoms, but may not really necessarily need to be tested, I guess.
And correct me if I'm wrong, but it appeared from the latest IDPH guideline that runny nose did get marked off, but congestion is still on there. But that would kind of fall back to if they are showing one of those symptoms, that they would need to be, and it is due to another cause. If the parent feels like they have another medical condition that's causing that symptom, they would have the opportunity to see their provider and to get that evaluated by the provider, and to provide us with documentation that it's due to another medical cause, not to COVID.
Will the schools be releasing our child's medical information?
No.
No. Okay.
And I'm trying to think of what that might be.
I'm assuming if their child tests positive, is that information going to be released? Maybe that's what they're asking.
No, not by us. Okay, no. Yeah, absolutely.
We would get notification of the health department of a positive case. The preferred method is that when we notify the parents that their child is positive, that the parent will call the school and tell your school nurse or Mr. Quick that your child is positive, so we can start the investigation process to quarantine. It's really important that your school knows who the positive is, and we want the parent to tell that, not to come from us, so that we can freely talk with them about it. But regardless, the school or us, no one is ever going to release a name, a description, anything that's going to identify that child.
Anything different on there, Andy? Trying to look to see if there's any questions that have already been kind of.
With, this is for the health department, with one symptom dictating a COVID test prior to return to school, does the health department feel confident in the number of testing kits available?
Yes, I think we have adequate, the hospital should take this one. They know more about what equipment, or what, they have there, so I'll let them answer this.
Yes, so if a student has a symptom, then they would be referred to their provider or the walk-in clinic or whatever, provider they're going to see. And then that provider would determine if a COVID test is necessary, because there could be an alternative diagnosis. If the COVID test is warranted, then they would order that, and then we would have that testing capability, yes. We have the drive-through COVID testing, so that is scheduled, and the parent would take the child to our south entrance to the drive-through testing. We would get all that information ahead of time, get them registered, and all they would have to do is go to the location at that time, get the COVID test, and then that would be it. So yes, the short answer to that is yes, we do have the capability.
That was good information, thank you.
For the remote learning, is there a certain time that kids have to be online for instructions? Or is it up to the parents as to when they complete the work for that day? Is there a certain amount of time they have to be on remote learning each day?
Okay, so I can address the last part, and then I may ask for some help from principals, because it's a little bit different at each building in terms of how that's going to work. So the last part where it says that they have to be online a certain amount of time each day, the guidelines that we have from the Illinois State Board of Education say that they are supposed to be engaged in learning activities for 5 clock hours per day. So that is identical to the amount of learning hours that we have to provide for our in-person students. Now that does not mean, however, that the students have to be in front of the Chromebook or in front of the screen for those full 5 hours at all. That can include other learning activities, even things that are going on in the home, reading books. So it doesn't all have to be screen time by any means. So the answer to the other part of the question is a little bit different on depending on the grade level. So at the K through 5 level, we have secured subscriptions to an online curriculum for those students, and they will have a login and access to that. Our K through 5 students are also being assigned a homeroom teacher who will be a grade level teacher, just like if they were learning in person. That way it's someone that's going to develop a relationship with them, going to check in on their learning, and in the event that that student is able to come back to in-person learning at some point, they're already going to have that relationship with a teacher. In addition, the elementary students will be assigned a remote learning teacher. Now that may be a classroom teacher, or it may be another certified teacher within the school. And we're fortunate that we have plenty of teachers that have volunteered for that duty to manage the remote learning at the elementary level. At the 6 through 12 level, each teacher is going to be managing their own. That was a big part of the reason that we had the adjusted schedule this year at the middle school and the high school, so that we could provide time at the end of the day for those students to do for those teachers to make those preparations and make those contacts with students. So I'll hand it over to principals to give any specifics.
I know for the middle school, most of our instruction for the remote learners will be asynchronous. The teachers will post the lessons for the remote learners most of the time in the afternoon after the in-person learning. Students have been dismissed for the day, so they will either operate a half a day ahead or a half a day behind, however you look at it, in most cases with posting their lessons. But our goal with that is to keep the students here and the students at home doing as close to the same learning activities as possible, so that in the event we are allowed to come back, everyone will be on a fairly even playing field as far as the material that they've learned. And in the unfortunate event, if we have to all go home, kind of the same thing. Everybody's been exposed to the same material up to that point. But it will primarily, for the remote learners, be asynchronous. It will not be from 8 to 8:30, you're in math class. From 8:30 to 9, you're in grammar writing. That's not how it's going to operate. Those lessons will probably all be posted in the time frame from 1:45 to 3 o'clock, and then the students would have the 24 hours or however long the teachers are giving for the assignment to complete those assignments. And as Mr. Quick said, approximately the same 5 hours of learning time. And one thing I do want to point out is that we do intend to have PE as part of that instruction, because we think it's important for students to remain physically active, especially when they're at home during this time. I'll turn it over to Mr. Stark.
Yes, our students will be on the Acellus online learning program. That information will be coming out to those parents and families in the next day or so as well, as we get them enrolled into the classrooms and start being able to provide that information to them. But we will be a little different in the sense that from the middle school and high school, in the fact that we will be providing strictly online through a program. But we will have teachers from Washington Elementary who will be able to assist our students and give them an opportunity to ask questions, and if they're struggling with a subject or a concept, to be able to work through those with individual teachers who will check in with them on a regular basis. I'm also encouraging my teachers to touch base with those students. All those students who are remote learners will be assigned to a classroom teacher specifically. So all our second graders will be assigned a classroom teacher, so that if they do come back to us for in-person instruction at any point in time, they'll have someone that they'll land with, and those teachers have been asked and instructed to actually go out and reach out to those kids at least once a month, and to try to build a relationship with them as well, so that they aren't kind of coming in sort of flying blind, so to speak. So, but what Mr. Quick mentioned was spot on as far as that's concerned. We will be providing that instruction too.
Mrs. McDonald from the high school wanted me to add that they will be asynchronous as well.
Do you want to talk about Lincoln?
Mrs. Beaumont.
At Lincoln Grade School, we're also using an online curriculum, the same that Washington is. And so what Mr. Stark said is pretty much what will happen at Lincoln also. Each student will have a homeroom teacher, and that teacher will be contacting the student and making those connections. And then they will have a remote learning teacher from Lincoln Grade School that will be contacting them. One thing is, with the online program, we do need to take attendance every day. So students do need to get on each day, but it doesn't mean that they have to do all of their work that day, because we know that family schedules are different. here, you know, as far as work schedules, and so a student may not be able to get to some of their work till Saturday or Sunday, and that's fine, but they do need to check in, and there'll be a pacing, the program has a pacing guide to it as far as what you should complete within a certain amount of time, but then the remote learning teacher will also help with that.
Another question here, this might also be to some of the principals. What about bathroom breaks? How are you going to ensure that they are practicing proper hand washing? And what is the sanitation process for bathrooms?
Okay, Mr. Stark is gonna take that one
I'll
for
take that one right away. At Washington Elementary School, we have traditionally in the past done like a group-wide bathroom break, so we'll take a whole class of kids to the bathroom. Because of that, because of the challenges with some of that, with crowding and so on, we've adjusted some of those strategies. For example, our kindergarten classrooms and our pre-K classrooms all have bathrooms in each individual classroom. So we are set to go in there, those kids will be in there, using the bathrooms individually, and then obviously the teachers will kind of supervise them as they're washing their hands. We've also instructed our staff to, every time the students come into, at Washington Elementary, we also have sinks in every classroom. So every time the kids come in, they're instructed to actually go wash their hands at the sink, and they can be supervised again by the teachers at every opportunity there. So we've kind of gone over and thought through that process with our staff, and that's something that we've actually had a lot of discussion with not only our staff, but with our health providers, which in Cindy Rimmel especially was one of them that was able to provide us with a lot of guidance on that and help us through that process. Does anybody else want to jump in on that?
We will not let students use the bathroom at Nuttall. I just wanted to break the internet. I'm kidding. I want to see if our viewership goes up or any comments come through, so just testing all of you out there. No, Nuttall's very similar. We're going to have different bathroom procedures. Like Mr. Stark said, you know, in a school, typically you have a bathroom break time where kids that need to go get up and go in mass. Obviously, we can't do that. So here at Nuttall, we're not allowing any teacher to send more than one student to the restroom at a time. When the students get to the restroom, there will be hand sanitizer outside for either beforehand or afterwards, or both, hopefully. And we're going to encourage them to wash their hands. But we'll also have a system in place to only allow 3 students in the bathroom at a time, because that's the number of toilets or urinals in the bathroom. So we'll monitor that closely and try and teach the procedures here through the first few weeks. We will let them go to the bathroom, I promise you. I'll go home if you want me to.
Regarding hand washing, how we're gonna ensure that students are washing hands properly?
I stepped out to use the restroom actually. But I don't know if it was.
Did you wash your hands properly?
I don't know if it was mentioned while I was gone, but Kim and myself sent out some educational videos for our staff members to share with the students as well that are age appropriate. So that would be helpful to those kids.
RHS has scheduled bathroom breaks during each class period as well.
We do have a suggestion for Mr. Beals that there is woods around Nuttall.
Look what I started.
Can a family opt out of testing and doctor's visits if their child develops symptoms and just switch to e-learning for the 10 days required? Multiple doctor visits for multiple children is not feasible for every family in our district.
So the question is if symptoms.
So if they are sent home for the 10 days, then they just switch to e-learning instead of getting tested or going to the doctor.
Okay, so there's a specific protocol for symptomatic individuals without diagnostic testing or clinical evaluations.
They have to stay home for at least 10 calendar days from the onset of symptoms, and then also for at least 24.
I don't think that's coming out anymore. So, microphone shut off.
Test.
There we go.
No, it was just too far away. So they have to stay home for at least 10 calendar days from the onset of symptoms and for 24 hours with no fever, without any fever-reducing medication, and have improvement of symptoms. And then it says, as far as documentation that would be required, and please correct me if I'm wrong, ladies, but a note from the parent or guardian documenting that the ill student or household contacts are afebrile, meaning no fever, without fever-reducing medication, and that the symptoms have improved.
Yeah, so can they just, instead of going to the doctor, can they just go to e-learning?
Okay, yeah, so I guess I looked at that as being two questions. One is that they wouldn't necessarily have to go to the doctor, although we certainly would recommend that if they're showing symptoms. And in terms of e-learning, yes, in our return to school plan, we have kind of looked at 3 different levels of the remote learning. So we've got the first level of remote learning is for those that are choosing from the beginning of the year that they want to start with remote learning rather than come back in person. We've also made arrangements for those short-term situations where a student may have to be out for the 10 days or, for COVID-related symptoms or for other illnesses, and we would handle that much in the same way that we do other long-term absences in the past. So maybe a combination of some work sent home, but that could be supplemented by some things also done through the Chromebooks. And then the third level of remote learning that we plan for is if, and we hope obviously that this doesn't happen, but if we would get into a situation where there's spread and we do have to look at closing a school building or closing district-wide, closing the school buildings district-wide. So that's kind of the final level of remote learning, but we have planned for all 3 scenarios, and yes, that would be a possibility.
Josh, can I say something real quick, and I'm gonna have to leave? Sure. So I just wanna say, like, as a fellow, like, healthcare worker, oh, you need the mic?
Yeah, they're,
Okay.
no, I'm down here.
Can you hear me now? Is it good? Okay, so, I'm Michelle Elliott, and I am a fellow healthcare worker, and I'm also a parent of 2 students in this school district. We've dealt with COVID for 6 months at my facility. This is kind of turning into old hat for us. We're in a surge somewhat at this point, so, I mean, it's getting risky and ugly again, but, it was gonna come at some point to our rural communities. Everything is out of our control. We cannot control everything, and I think that's what the public really needs to grasp, is there's only so much that you can do, and you as parents are responsible for a bit of this pie. I mean, the school district isn't responsible for everything, and we all have to have some ownership in this. I think, as far as I can see, you guys have been excellent in your planning. You've taken into consideration more things than I would have ever thought. I have been to other school districts, and I've seen that they are not prepared. They are not prepared at all. Staff aren't wearing masks. There's not social distancing. There's not even a proper training, and the kids were coming into attendance the next day. So I think that we really need to count this as a blessing that we have such great people that are so concerned about our kids. And I'm truly thankful for you, because this is gonna change every day. Whenever we first hit with COVID at my facility, our rules changed 2 or 3 times a day, every day, for weeks. And you're notifying multiple staff. And it's hard, and it's ugly, and it's stressful. But if we just kind of all get on the bandwagon that we're gonna get through this, and we don't wanna point fingers at the school district, we don't wanna point fingers at the health department, but we wanna look at them and say, how can we support you and help you? I think that's gonna make a huge impact on our kids and their school year. So, that's my soapbox, and I just wanna thank you.
items on here, not so much questions, regarding the social emotional aspect of this, and since Amber's here, I just wondered if she would want to speak to that a little bit about some of the planning.
Amber's in the other wing here, and she hasn't really got to speak either.
Sure, what do you have?
That was, I mean, just
Oh, what was the question?
yeah, I'm
Say
sorry,
it
just
again.
kind of like an overall plan on, or, you know, kind of what the focus is gonna be, I guess.
Right. Well, I know, I think all of our staff, the counselors, have addressed a refresher with their teachers and other staff members about anxiety, what that looks like in kids. So that's one of our steps. Also, I just want to ask the parents, you know your kids best, and so if you are concerned about them, their anxiety level, reach out to the counselors, phone call, email, whatever the procedure is, whatever you feel comfortable with. Don't hesitate. I know when I was talking to my staff today, I mentioned headaches and stomach aches can be signs of anxiety, also can be symptoms of COVID. So, you know, we'll address those as they come up, of course. But you know your kids, and don't hesitate to reach out to the counselor in your building. Every building will have has a counselor, and so I just want to make that known that we expect you to do that. Also, I want to point out that CMH had, I think her name was Dr. Kinsel Evans. I've not met her, but I heard her on the radio the other morning. She had done an interview on WTYE, and it was an excellent conversation she had. I really appreciated one of her points, and that was that parents not vent about their frustrations with this in front of the kids, but to go and do that in the other room and have an adult conversation. Our kids really pick up on our energy and just our own anxieties or our frustrations, and so they'll carry that and they'll have that inner turmoil of, my teacher says I have to wear my mask and I should stay away, but my mom says this is stupid. So just put on your positive pants and build them up this weekend, and really encourage our kids to show respect towards others as they come into school, and then we'll just hopefully see how things go. So I don't know if there's any other questions related to that.
No.
Okay.
Thank you.
Okay, sure.
If you're here, did you want to say anything more on that as far as preparations? Thank you.
So obviously reach out to your school counselors first. They're gonna know your kiddos as well. But then if it is interfering in your child's functioning, they're not able to eat, do their work, complete basic tasks, and it's becoming something that is much more than you would expect out of your child, reach out to us at the health department. We can get them set up and get them into services as well to help them work through some of the anxiety, depression, things like that that have gone on during this whole pandemic.
Okay, I have another question here that was submitted in writing. Is the school and CCHD working together to come up with a plan for influenza vaccine clinics for students? So I don't know that we've come up with a plan, but that was something that we did discuss in a meeting about a week or so ago. So I don't know if you want to address anything further with that, Jenna?
We haven't sit down and actually discussed how we would do it. We in the past have come into the schools and done vaccination clinics. In the last few years we haven't, but we used to do a lot of school vaccines. And this year we plan to offer, try to come to the schools and do it. We don't want the kids to miss any more school than possible. We want to try to, do everything we can to make them as healthy as possible and not miss school. And I feel like it would benefit the parents, the kids, everyone, if we come to the school and do the vaccinations. Just make it all the way around easier for everyone, but we've not actually sat down and planned it all out yet, but we've done it in the past, so it's not gonna take a lot of planning. Do you guys have anything?
They made me wonder if consent, how you consent for something like that.
We always send the consents home with the parents, is what we've done in the past. I don't know if there's any, I'm sure what we'll do this year. We've sent all the paperwork home, give them ample time to get it back, have the date set, and just backstay at the school. Like I said, we've done it many times in the past.
Thank you. So definitely something that we do plan to work together on, and again, something that has been offered in the past and that we're very interested in continuing with the health department. So we're coming up on 7:30 now. So I think I'll kind of go around to the panel and see if there's any closing comments. You have,
I don't have anything right now.
from each of the organizations that's represented. So we'll go down to the hospital first.
Thank you for hosting this. This was very informative. I think that hopefully the community takes from this that there's a lot of resources here at stake and at your disposal to make sure that your kids are safe. One thing I do want to touch on, Ms. Elliott made a good point, and some of the counselors made a good point. This is a virus. Kids are going to get infected. Parents are going to get infected. There's not a stigma associated to this. You see communities that have been unkind to each other, and you see someone who tests positive. Rise above that. Don't go to that level. It's no different than getting diagnosed with a cold, getting diagnosed with strep throat. We're going to have positives. There's no finish line in this race. So just keep that in mind. When you know that that's happened, kind of stay out of it. Let the people get healthy and support them.
I can actually make this very short because my staff was sitting here talking to me, telling me to do my be kind speech, but Doug just kind of did it for me. And that is what we just keep stressing. This virus does not discriminate. It does not care who you are. It does not care what your social status is. It does not care what type of car you are driving. It is a virus. Be kind. You have no idea what someone may be going through or what their home situation is. So I would just like to stress that.
I would like to say, the school's taking the precautions. We're all working together taking these precautions. If you would be mindful outside of school in your everyday life to continue to take those precautions, because that's going to help keep our schools going, schools, businesses, everything, if we take those precautions and decrease the spread. Echoing on what they have said down there, we all have a common goal. We all want to keep our kids safe, healthy, happy, do what's best for them. So let's all work together to make that goal a success.
I would just like to echo.
Just have to hold it really close.
Okay, I would just like to echo what Michelle and the others have said. I want to thank Josh. I mean, he has put in countless hours on these meetings and the committees, and I know he cares so much about the kids and their safety. And I really want to thank Lawrence County Health Department for partnering with us and having a nurse practitioner that we can contract with to work with the school nurses. And I just want to thank all of you for all of your work.
I basically would like to say the same thing. I am grateful for all these people up here. We couldn't do it without them. I think that we need to realize how lucky we are for the support that we have as far as not only school staff, but the resources out in the community that we have, and I'm grateful for them and everything they give to us.
I don't think I have anything else to add. I had my 2 minutes.
All right, with that, we will bring it to a close, and I just wanted to echo the sentiments. This was such a complex task, and we, as a school administrator, I am not an expert on public health. There are a lot of these things that I just did not know or have the expertise on, so that's why I'm so grateful to have strong community partners and people that were willing to give hours and hours and hours of time and expertise over the summer to help us to come up with this plan and to do everything that we can to ensure that our students can return to school safely. So we appreciate everyone up here. We appreciate everyone that put work into the plan. We appreciate our parents and our families. We're really looking forward to seeing our kids on Monday. Please be patient with us. Things are going to change as the situation evolves, but we will do our best to continue to communicate with you, and we look forward to working with you this year. Thank you and have a good evening.